Among those millions of Georgia frontline workers out there risking their own health and safety every day for the larger benefit of our communities, 12.2% of those workers are immigrants. In fact, foreign-born Georgians make up for 33.4% of meat processing workers, 38.7% of construction workers, 29.1% of building cleaning service workers, 17% of physicians, 12.6% of convenience, grocery, and drugstore workers, and 10.9% of nurses. And yet, far too many frontline workers, foreign-born and native-born alike, do not have access to health insurance through their employer or at rates that are affordable. According to the 2018 American Community Survey, there were 28.6 million Americans without health insurance. Of those 28.6 million, 27% were non-citizens. The number of uninsured Georgians for that year was 1.4 million, putting us at number 3 for states with highest rate of uninsured residents, only behind Oklahoma and Texas respectively. There are policy changes Georgia lawmakers can make to expand access to affordable health care in Georgia. For one, we can accept the federal dollars that were set aside specifically to expand Medicaid to uninsured Georgians. This would help provide health coverage to approximately 500,000 individuals compared to the estimated 65,000 individuals the state's current plan is expected to cover. The impact of these numbers when considering Georgia's children and mothers is particularly alarming. Georgia ranks 5th in rates of uninsured children, and for immigrant women there are even more barriers to accessing coverage because of their non-citizen immigration status. Mujda, a childbirth educator studying to become a licensed midwife, shares her perspective.
Hello, my name is Mujda Uriakhil. I am originally from Afghanistan and have been living in Georgia since 2014. For the past 6 years, I have been working as a community liaison and childbirth educator with Embrace Refugees Birth Support, one of the part of Friends of Refugees program, a non-profit organization based in Clarkston. Every week, I work with new mothers to help provide quality prenatal and postnatal education. I spend many days and nights helping provide language interpretation for expecting mothers at their doctor appointments and even while they are in labor. In Georgia, new mothers who receive Medicaid while pregnant are removed from the program shortly after giving birth. I have a personal experience helping clients who experienced severe health complications post-pregnancy and was too afraid to visit the doctor. Thankfully, with the Aetna of Health Center in Clarkston, we were able to get her access to affordable treatment. However, she waited 6 months to take this step. If she had Medicaid, she could receive the assistance she needed right away. Everyone has the right to live a healthy life. For this reason, I am calling on our state lawmakers to make policy changes so healthcare can become more affordable in Georgia.
Healthcare is a right that should be extended to all Georgians, not only now during a pandemic, but always.